Hey, Dr. Ryan Hetland here. Welcome to today's 3-minute video. Sorry about the echo. I'm here in a room and I wanted to tell you about kids' posture. Obviously, this is my wheelhouse, so to speak. So when I go out and people say, "Oh, isn't that kid cute?" and I'm sure the kid's cute, but I'm at times noticing stuff like this where their shoulder is way off, where their shoulders tipped this way, or their head is like this, where they're standing like that, and I'm seeing health issues that to me are like obvious, like that color's red and that color's orange. Things that are super obvious to me aren't obvious to patients and to just the world. They're not looking at that lens, their kid through that lens, and they're not trained to do that, so obviously there's nothing wrong with that. I just want to point it out, so if you're a parent and your kid has any one of these postural issues, you should bring them to a chiropractor to get checked out, because if they continue to live life in these sort of postures, things are just going to get worse and worse and worse, and you'll end up getting symptoms, if they already don't, like headaches, back pain, and any number of conditions where health problems where you're affecting the nerves, because as we know, the nerve system comes out of the spine. So whenever you have a spine malformation, subluxation, where the vertebra is out of position, it can influence the nerve system and go back up to the brain. So we obviously have issues in postures like this, where you have sway back in the low back, where the belly button and the belly go pushed out. You have where we've talked about this in the past, where you have forward head posture. Something that this shows here is like a scoliosis, where you can see the shoulders are off and the hips, sometimes the hips can be unleveled. That, even without an x-ray, would indicate typically that there's a spinal problem in there that should be worth checking out and even getting an x-ray for, depending on the age of the child, etc., etc. Now you can see, sometimes we tease that people's heads aren't on straight, just like this. So I more often than not have patients that come in and I have to tell them their head's not on straight. And they usually say, you know, that's not the first time anyone said that to me. Usually their spouse they're referring to, or something, or their parents. And you know, there's a lot of truth to it in some regard, because a lot of you are walking around with your head not on straight. Go ahead and look at pictures, your Facebook pictures or whatever pictures you got, even as a kid, and notice and just look and see, is one ear higher than the other? Like you'll notice here with me, you can see this ear is higher. Now normally it's not, but in pictures you'll be able to see that. So take a look at that. Another common thing that doesn't really show on this poster is when the feet go out, or when the feet on kids go in. If they go too far in, people will be obvious, and it'll be, oh, this kid has pigeon toe, or they're too flared out. Or look and see if one foot is out more as they're walking, or one foot's out in more than they're walking. But just pay attention to these things. These are key signs to not ignore. You should be looking for these in your kids. And just like if you saw a steak stuck in their tooth, you'd probably want to floss that out and brush it out, so the food doesn't just stay in there. That chiropractic adjustments for kids 18 and younger, and obviously even at birth, the sooner you identify these smaller problems, the quicker you fix them, and they don't struggle with this for their whole life and years. Like oftentimes my patients come in, they're 40, 50, 60, 80 years old, and they've never been to the chiropractor. No one ever told them that this was important for them. Unfortunately, they didn't have a parent that knew any of this to be able to tell them. Oftentimes not the parent's fault, and it's just a matter of that's the first time they heard it or finally took action to do something about it. So any parent that brings their kid into the chiropractor to get checked at a young age, that kid has got an advantage, and the parents should be proud. So feel free to comment, message me, ask me any questions about pediatric chiropractic care, your kid's posture, and look forward to hearing from you. Have a great day. Bye.